Hi everybody, my name is Dr. Malvika and welcome back to the IMG Marvels YouTube page. Today we're starting a new series. This is a series for people who've just accepted their first job in the UK and are planning to make their way over. It's going to include things like visas, housing, bank accounts, and all of the adulting that is included in picking up your life and moving to a new country. The first video is about more administrative things that you need to get sorted while you're still abroad and right after you've just accepted your first job. So after you've accepted your first job, the first thing you need to get sorted is the visa. Most IMGs come over because they've been sponsored and they've gotten a post, either a trust grade or a training post. The sponsorship can be either by the hospital itself, the trust, or by Health Education England in case it's a training post. You need to get your certificate of sponsorship and then apply for your Tier 2 or health and care visa. Now, we're not going to go into how to get the visa and how the application process is. We're not experts in immigration. We can't really help you with that. You'll have to go through the different immigration specialists and different visa offices to get that sorted. It obviously goes without saying that please apply as early as possible and get all your visa documents ready and double checked, and make sure you check with people and online on forums that you got all the documents, you got extra documents if anything. They're all translated and correct for the application, and you got as much proof possible saying that you are going for a legit reason to be a doctor in the UK. But the one thing that I would tell you is that if you have applied for a visa and you think that your visa will not come in time, then especially if you're starting a training post like F1, then you need to make sure that your deanery knows that your visa is delayed. There is a rule that if you miss more than 20 days of any foundation training post or any training post, then you become ineligible to pass ARCP, which is the final exam to finish that training year. This 20 days obviously does not include study leave and annual leave. It's more regarding sick leave and days missed. So if you feel like you're going to be late, then you need to let your deanery know ASAP. If you think you're going to be more than 20 days late, then either you'll be able to join whenever you can make it to the UK, and you might have to extend your training a little bit. Mostly it's by 4 months, regardless of how much you've missed. Or you'll have to defer your place to either 4 months later, so starting from the second block of your rotation, or deferring to the next year. And then sometimes it's possible that you might lose your training post. So it's very essential that you let your deanery know the minute you know that your visa is going to get delayed, that you might be delayed by a few days, and talk about how they want to deal with it and if they can make any exceptions for you. The next thing that you'll probably be handed online while you're still abroad and applying will be your HR forms. So Human Resources will send you a bunch of forms to be filled out. Make sure that you fill them out correctly. Make sure that you fill them out and send them back in time. These are important forms and they will determine your smooth transition into employment, and that most of the checks and everything are done so that you can continue as a doctor from day one in the UK. Again, delays in these things will delay you starting your job and then can affect your training time. The HR forms are kind of tricky to go through. If you have any questions about them, just ask the people, email them. Normally the HR managers are really friendly and they understand that people are filling these forms for the first time, so they will tell you exactly what to fill. Make sure that you fill them correctly. Ask other trainees what they filled in those forms, and if it's correct, ask your alumni, ask your seniors, and just make sure that all the paperwork is done correctly and given to them in the right time. They will then arrange an identity check for you. Make sure that when you come to the UK that you bring all your documents that you think you might need. There are certain things that people don't accept as identity check in other countries that might be accepted in the UK or vice versa. And Some documents might have to be translated before you can get them here and use them as an identity check document. So make sure you have all of that done beforehand. Also carry all your important documents, your vaccination status, your birth certificate, your passport and previous passports. Have things like your travel history and your addresses at hand for the last 5 years almost. Have police clearances, etc. And just carry physical and soft copies with you, because you might even need them at immigration. As a doctor in a new job, you will also be asked to do a DBS check. DBS standing for Disclosure and Barring Service. And this basically is a identity check of some sort and a security check that because you're going to be a doctor and you're going to have access to a lot of confidential information, that you are a person that doesn't have a criminal record or is safe to access this information. A DBS check is not normally done when the trainee enters the UK for the first time. It does take up to 3 months, and that's completely fine. But you do have to give them all the documents and applications and everything, and then they will prompt you by their online system to get a DBS. When you do come to the UK, your passport will be your primary identity document before you get your BRP. Your BRP is normally ordered beforehand and you have to collect it once you arrive from a post office. Get your BRP as soon as possible, and then you'll have to take that to your identity check for the hospital as well. If you're getting delayed, let them know, and sometimes they'll be like, it's okay, you can get the BRP to us later, or you can scan it to us later. But you might have to show them some other documents in the meantime. But get your BRP as soon as possible. Your BRP then becomes your primary identity check documentation in the UK. The other really time-consuming thing that you'll have to do is occupational health checks. Take this quite seriously, because there are specific guidelines that you have to follow. As a doctor, you must be vaccinated and you must show occupational health, your vaccination records. They might also ask you to do other blood tests like antigen tests for Hep B, etc., which you have to show before you go into the country. Also, if you're from a country that is known to have a high prevalence rate of TB, you'll have to get a chest x-ray to prove that you don't have TB and show that to them, and have a certificate printed from the place. The chest x-ray is done at only very specific locations in different countries, so you might have to travel to a different city. A chest x-ray or a certificate from just anywhere will not do. Make sure that you know what centers are nearby and what centers will be able to do your chest x-ray. They are also quite expensive, but that's the only way you can prove your TB status in the UK for occupational health reasons. And make sure that you're talking to occupational health via email, and that you're setting up an appointment really early, maybe on your day of induction or even before that, before you start work ideally, because they'll do some blood tests, they'll give you vaccines that you haven't got, or they'll do some antigen titers, etc., and they will contact you if there's any problems. They will also do a TB monitor test for you, depending on where you've been and where you've traveled. You want to get all of this done beforehand, because you can't go onto the wards in a lot of trusts without having cleared occupational health. Occupational health will also ask you about your medical history, and if there's anything that you think stops you from being able to perform at 100%, or anything that you think is a hindrance in your capability to provide safe and good patient care, then you need to let occupational health know, and they will make adjustments for you. This is not just at the start, but also throughout your training. So I knew a doctor who broke his back. He got a slip disc, and in the training they made different arrangements for him, so he wasn't standing for long hours. He was allowed to take more breaks, and any of the issues that came up, he was allowed to have some adjustments for it. Also during COVID, people who were vulnerable were allowed to isolate and not specifically be in COVID areas. People who were pregnant were allowed to isolate and shield and not be in COVID areas. So anything that you're struggling with, just let them know and they will make sure that they arrange for that. This includes having learning difficulty, or having hearing aids or hearing problems, or If you have back problems and you can't stand for long or anything that might hinder your ability to work, just let them know and they will make reasonable adjustments for you. They are normally very, very good at things like that. Also, as I said, if anything happens during your training as well, do keep letting them know, do keep them updated, and they will make reasonable adjustments for you as is recommended. You might also be asked to do some statutory and mandatory training from home before attending your induction on day one. This is normally online training, and they will give you either an email or an admin or whatever details to log in. This is training like fire safety training, sepsis training, community and harmony and racial diversity training, things like that are basically necessity for you to do as an employee and to start the job. They can be quite long, and I know that we're all busy with the traveling process, but they are important, so make sure that you do them before your induction. 6 weeks before you're actually meant to start, you are meant to have a rota specific to you, and make sure that you know exactly what shifts you're doing and when. This is a legal requirement for them to give you a rota 6 weeks in advance. So look at your rota, look at the rotation that you're doing, make sure you know where you're going on day one, which department you'll be working on, and then the department and the trust will have 2 separate inductions. So the trust induction is, let's say, so I work in University Hospital of Leicester NHS Trust, so they did a different induction for us. And then I was specifically working in general surgery, Leicester Royal Infirmary, so they did a different induction for us for that. So there's a trust induction, which kind of tells you how the area and the hospitals and the trust work in general. And then there's a specific induction telling you how the workplace that you are specifically starting in works and what they expect from you. So you should have 2 inductions. Make sure that you know when and where they are and they're not colliding, and if they are, just let people know. And make sure that you attend both inductions, make sure that you pay attention. Some inductions are now done online because of COVID, so make sure that even if you're abroad and if you are delayed, that you attend the induction online, because sometimes they might not be able to give you a full trust induction again, but they will make sure that you get a local induction again.